Hello friends and welcome back to my channel. In this video we are going to talk about the orthopedics related to the croc exam, the prevention and care, the palliative care, renal failure, pleural pathologies, and some questions over the lumbosacral radiculopathies. So let's start. So first of all, let's see how the pelvic looks anatomically, because we are going to discuss about the orthopedics in the croc questions. A lot of problems are related to the femoral bone as well as the pelvic fractures are there, and some of the lumbosacral radiculopathies are there. So let's see the pelvic here. This is a defined anatomy of the pelvic region. So in the left portion you are seeing in the middle there is sacrum, on the left there is the greater trochanter and ischial spine. Here is pubic tubercle. On the right side, as we can see, this is known as the wing of the ilium. On the right portions, as you can see, anterior superior iliac spine. So this is the we also call it ASIS. Next, under the sacrum you can see coccyx is there, the lumbar part and sacrum and coccyx. In the right portions you can see anterior inferior iliac spine, articular cartilage, greater trochanter of the femur, lesser trochanter of the femur, and in the below, just on the femur, have a look over the pubis ramus. There is a question in the croc about the pubis ramus fracture, so look at it. How does it look in the lower part? So there is superior pubic ramus, inferior pubic ramus, pubic arches are there, and right one is the obturator foramen, since obturator nerve passes through it. Next is I have discussed about Erb's and Klumpy's paralysis in my first video of the YouTube channel. I have provided you very well defined photos over there, but I just wanted to provide you with the table highlighting the differences between both of them. So Erb's palsy is the problem with the C5 and C6, and Klumpy's is the problem with the C8 and T1. So Erb's is more common. This is Vater's tip deformity we are going to see in the patient. You can check the first video, guys. You will see how the Vater's tip look like. The better prognosis are of Erb's palsy. In Klumpy's paralysis, you can see the claw hand also in the photo. Horner's syndrome you will see in the patient of Klumpy, and the prognosis for Klumpy are poor than the Erb's palsy. So, sir, we do not remember that how the examiner will ask about the Erb's palsy. So here is a mnemonic for you. So these are the movements which will be lost in the Erb's palsy. The mnemonic is Faber. So Faber will be lost in Erb's palsy. Let's see what is Faber. So sir, Faber F is the flexion of elbow which will be lost in the patient, abduction of the shoulder, external rotation, the supination of the forearm. So these are the movements. The question will tell to you that these are the movements lost in the patient. Next, sir, we are going to see Horner's syndrome in the cases of Klumpy's paralysis. So what is Horner's syndrome? Ptosis, meiosis, the sunken eyeball, anhidrosis, loss of a spinal reflex. So these are the problem which we are going to see in the patient of Klumpy paralysis. Next, let's move to some questions. So most of the question in the orthopedics are related to the lower trunk. So even in that lower trunk, most of the question are related to the femoral neck fracture. So let's hear to our patients. So first patient complains about that emergency team delivered the 83-year-old patient, complains about inability of her right leg to support. So the body after falling on her right side. Patient lies down. Patient leg is rotated outwards. The outside edge of the foot touches the bed. positive straight leg raising test. So sir, what is straight leg raising test? Please watch my first video. I covered most of the visual tricks for the croc part 2 in my first video of the channel. So sir, straight leg test is when we elevate the leg of the patient will report the pain. Sir, why? Because the femoral neck fracture is there. This is not the hallmark finding for the femoral neck fracture. However, when there is a femoral neck fracture, the hallmark finding is right leg is rotated outwards. This is something the hallmark finding. So just imagine your right leg is just rotated outwards and you are trying to make it inwards, and it is just not possible. It's just not possible, because then when there is femoral neck fracture is there, so the part of the lower trunk which will allow you to move your leg inwards is fractured right now, so you will not be able to do so. And you got whatever was needed in the question, femoral neck fracture. Let's move next is second patient says that the 9-year-old boy fell from a tree, hit his back, loss of consciousness, child condition is satisfactory, headache and vertigo, depressed fracture of the occipital bone in the area. What tactics you will do? So sir, occipital bone fracture is there, we are going to open everything and correct everything, right? So surgical intervention, I hope you are aware about this question already. Next is after falling and hitting the back of the head, the child lost hearing in the right ear, developed peripheral paralysis and right facial nerve, discharge of a clear fluid. Sir, what is that clear fluid which got discharged when the patient got hit on the back? Sir, this is CSF. When the CSF will be clear fluid when any fracture is there and a clear fluid comes out. So this is for sure CSF. Right, from the right auditory canal, diffuse neurological symptoms. Sir, what would have happened in the patient? We see neurological symptoms in the patient. So this is the case of cerebral contusion. Sir, what is this cerebral contusion? So cerebral contusion is a type of head fractures, the traumatic fractures, the one of the type of the traumatical fracture of the brain. So this one is basilar skull fracture. Let's go next patient again says the external rotation of the hip, shortening of the limb, unable to perform the straight leg test because it is very painful. So if I just try to touch the leg of the patient and I'll slowly I'll try to raise the leg of the patient screams very loudly. Sir, why? Because he's having the femoral neck fracture, so he cannot even perform the straight leg test. This is something, external rotation of the hip will again be the hallmark finding here. During palpation and tapping on the head, the patient feels the pain in his hip joint. What would have happened in the patient? The patient is suffering from the femoral neck fracture. So let's see the next patient. Next patient says that on the third day of the life, newborn deformation, edema, hematoma of the soft tissues in the left supraclavicular region, arm is pressed to the torso, passive movement are accompanied by the fusiness of the child. So what would have happened in the question itself says that the left supraclavicular region, there is a hematoma. So if the hematoma is in the left supraclavicular region, so what would have been happened? The displaced fracture with the left clavicle, and the arm is pressed to the torso. So this is also something related to this third day of life, newborn deformation, edemata is there because blood got collected over there, a lot of fluids got collected over there. Yeah, a passive movement are accompanied by fusiness of the child. The child cannot make any movement because his clavicle got displaced from its place. Let's see the next patient. So next patient says that person fall from the height from ladder height of 2 meter. Emergency medicine physician suspects a vertebral compression of fracture at the level 1 L1 and L2. BP is low, pulse is high. What aid must be provided to the patient at the site of accident? So no need to do anything. Just make sure that the patient doesn't move at all, because lumbar fractures or at the level of L1 and L2, this is critical fractures. And what we need to do is analgesia. Analgesia is simply for the pain management of the patient. The patient is having severe pain, just give the pain management so that the patient can have a bit relaxed mood before the hospital, and transport him into the in the hospital emergency department on the hard stretchers. Sir, why hard stretchers? Sir, if you will move the patient or if the stretchers are loosened up, the patient will report the movement in the lumbar region. So if there is any movement we are associating, or if accidentally also some movement or more movement happens, so the our fracture is going to get complicated. However, we want to correct or solve the problem of the patient. So what we will do is we will transport him into the hospital on hard stretchers. Next is prevention. So let's move to the patients directly. The questions are simple and sorted. A regional cardiologist is asked to for the development plan for the cardiovascular mortality rates or the causes of them. Measures should be planned for the secondary prevention. So how the cardiologist will prevent the how the cardiologist will plan for the secondary prevention? By prevention of the reoccurrence of the disease plus complications. The next patient, doctor decided to direct the patient to the cardiologist for a consultation. General family doctor, it is written over here. So the general family doctor decided to direct the patient to the cardiologist for a consultation. What level of medical care is being proposed to the patient? So our primary doctor is our general family doctor. Now the general family doctor decided to direct the patient to the cardiologist or to the specialized cardiologist for the further care, because some problem might be complicated. Yeah. So primary care is our family doctor. So if the family doctor sends us to the specialized department in any department, that will be the secondary care. The third question, the woman made an appointment with a family doctor for scheduled vaccination of her 2-year-old child. What type of health care? So the woman made the appointment with the family doctor for vaccination. So this is primary care. We are trying to prevent some pathology by vaccinating our newborn. So this is something known as primary health care. Next patient. So next question says that what should be prescribed as a secondary prevention drugs for the patient with the atrial fibrillation after an ischemic stroke attack caused by cardiac embolism? Sir, if we prescribe anticoagulants or oral anticoagulants, yeah, this is the something we have discussed in the stroke part as well and ischemic stroke part, and even in the social medicine I have seen this question. We are going to prescribe oral anticoagulants, for example apixaban, warfarin. These will be the given anticoagulants or the names in the option if you see some question related to this. So oral anticoagulants will be provided to the patient for the prevention of the ischemic stroke, also the cardiac embolism. This is so to break up that. Next question, a district doctor was tasked to with the preparation plan for a complex treatment and prevention measures among the population in a district. What measures for the secondary disease prevention? So the option will give you that prevention of disease occurrence. Sir, you cannot prevent occurrence in this case. In this case you are just going to prevent the disease complication. So I said this line just so you remember. Sir, you cannot prevent the reoccurrence of the disease in this case. However, we did the plan with our doctor, our cardiologist, in first question that we are preventing the reoccurrence. as well there. But sir, you have to remember this in order to mark the answer correct, that the option will be given in fifth question, that prevention of disease reoccurrence. No, what you are going to do, sir, this is secondary disease prevention, so prevent the complications only. So I hope you will remember it. Let's go next. So to fight against the tobacco smoking, Ukraine has ratified the World Health Organization framework convention on tobacco control, and they prohibited the public smoking, like on the bus stop or on the airport. They prohibited the public smoking, but still the people can smoke in another places which are not really public, right, in a park or somewhere. Yeah, so this is primary prevention, that they are just preventing the tobacco smoking primarily, so that it will be prohibited in some of the areas, on the public areas. So this is primary prevention. Next is palliative care. Only one question over the palliative care. So however, palliative care is the form of medicine in which we provide the patient is living his last days with some chronic pathology or with cancer or something like this. So in the last days of the patient's life, we know that patient is gonna die due to some chronic thing. So we are going to give the best happy days of his life to the patient. So we will give him the best pain management and whatever things are necessary for his rest of the life, or the rest of the days or hours he is having. So let's see some only one question over palliative care in the croc exam I have seen. So the patient's son has filed a lawsuit after his mother died of breast cancer, due to the fact that the in the past she survived and had diabetes. Aggressive cancer therapy was contraindicated for her. She was suffering from severe pain, but the doctors at the clinic were not able to get even 1 gram of morphine for her treatment or her pain management. What kind of care have been provided in this case by the primary care doctor to relieve the patient condition? However, they did not really provided the care because they couldn't get even 1 milligram of morphine for her. The patient died in pain. So what we need to provide to the patient in such cases, when we know that the patient is having all of these chronic pathologies, we need to provide the palliative medical care to the patient, so that the patient can live his last days of life without pain. So the main things which are given used in the palliative medical care are most of the best thing is pain management. This is something what we are using in the palliative medical care. Next is renal failure. Sir, what is renal failure? So renal failure is the failure of kidney, or let's say the failure of the kidney to perform its function. So sir, what is the function of kidney? So the kidney function is filtration. Yeah, filtration, removing the waste metabolic products from the patient's body. So this is renal failure, the failure of the kidney to filter the waste anymore. So let's hear to some patients who got this. A woman with the polycystic kidney disease observed an increase in her 24 hours urine output to 2.5 to 2.5 liters. GFR is 34. Urea is this and this. Urea levels are higher though. GFR 34 here. What stages of chronic kidney failure? So there the examiner is asking about which state is there. So a normal GFR, as you can see on the top block, is 90 to 120 ml, but the GFR of the patient is 34 here. So the kidneys, the state of chronic kidney failure here is compensated because the kidney is still able to filter some 34 ml per minute. So if the kidney will be able to filter some 5 ml per minute, so that will be the terminal or the last stage when we need to send the patient for the hemodialysis. Yeah, so at this present stage the kidney is still able to compensate a little bit. So here it is written kidneys are still able to filter some of it, so the kidney is trying to compensate its best as it could. So next patient says that 3-year-old boy have severe edemas, objectively pale, BP is severely low, oliguria, urinalysis color yellow, specific gravity 10-20, protein level 3.5, significant for the glomerulonephritis. Erythematous length 4 to 5 in the vision field, leukocytes are 2 to 3 in the vision field, 24-hour proteinuria is 6.6, which is very severe in real. Even 3.5 is something we know that more than 3.5 proteinuria is for the nephrotic syndrome significant. So if you haven't watched my video over the nephritic and nephrotic syndrome, so watch it. It will be very helpful in short explanation for all the problem related to the kidney. The patient is cholesterol this much. Next step for patient's management, sir, take the kidney biopsy because something serious is there. We suspect something serious pathology because 24-hour proteinuria is really severe in this case. So take the kidney biopsy and act according to the results. Next patient says that after eating mushrooms, 30-year-old patient developed the nausea, vomiting, absence of urination. On the third day after the onset of the symptoms, the person sought the medical aid. Lab test says elevated creatine. Creatine is too much here. Normal levels of creatine, I'll let you know in some another corners what is the exact normal level of creatine, but just so you know, remember that they are around 1. So just think how many levels how many times it is elevated. So creatine levels should be 1, friends, and in this level creatine levels are far more than 1. They are like 699 times elevated than the 1. And urea levels are 32. I'll let you know about normal urea levels also in some corner, but just know here that urea levels are very high in this case. Treatment tactics. So sir, send the patient for hemodialysis before he will die out of more urine deposits. So urea deposits are causing a lot of severe patients problems in the patients. So send the patient for hemodialysis. And yeah, I hope you understand. Only 3 questions over this portion. Next is pleural pathology. We have seen the pneumothorax very well in my last video. Hope you will see it. You will find it very short and simple sorted explanation for it. So pleural pathology, a 36-year-old patient developed with diagnosed with the right-sided pneumothorax treatment. Sir, what is pneumothorax? See my video. And what we need to do as a tactics, we need to drain the pleural cavity because the pleural cavity is filled with the air over there. So next patient 24-year-old male, acute post-traumatic emphysema of the pleura, x-ray widened horizontal level of fluid on the right. Sir, fluid got filled in the lungs. So what you are going to do, sir, make an incision and drain the pleural cavity. Punction, not the incision but the puncture. Punction or puncture, they are related terms to fine needle aspiration biopsy type thing. Punction means just make a puncture over there and drain the cavity. Next is pneumothorax again, so drain the pleural cavity. Next patient says that for the intensive infusion therapy, the patient with the acute respiratory failure underwent subclavian vein catheterization using this technique. After administration of so now here the question, after administration of 600 ml infusion solution, the patient condition sharply deteriorated. So let's see, tachypnea increased from 26 to 40, tidal volume decreased from 400 to 250, auscultation detect sharply weak respiration on the right lung, percussion detect dull sound. So the fluid which we infused in the patient has actually got inside the lungs here. This is why the patient condition deteriorated. So after hearing the case of pneumothorax, hemothorax, pneumothorax, now there is something hydrothorax. Sir, what is hydrothorax? Sir, you try to infuse the, after administration of 600 ml in the infusion solution, so you try to infuse the solution or some infusion solution in the patient for betterment of the patient. But what happened is that that fluid got filled into the pleural cavity. So sir, that's why the percussion sounds coming dull here. What complication developed in the patient? This is hydrothorax case. So the fluid got filled in the pleural cavity. Next is the 40% of the patient with the bacterial pneumonia develop concomitant pleural effusion. This diagnosis can be confirmed by the chest X-ray. This is correct. In the direct vertical projection, if there is at least. So guys, remember about this thing, something to remember, that we can diagnose pneumonia, we can diagnose pleural effusion on the chest X-ray, but we need at least 300 ml fluid inside the lungs or the chest cavity, so that we can see some opacity over the X-ray. All right. Let's go next. Next is lumbosacral radiculopathy. So you have seen the diagram of the pelvic region very well. You see the anatomy already. Next, this is the condition. Lumbosacral radiculopathy is a condition where one or more nerve root in the lumbar region of the spine are compressed or irritated, leading to pain, weakness, numbness in the lower back of legs. So sir, if the nerve compression is there, how you are going to diagnose the condition? First of all, sir, X-ray is not going to work in this case. You want to see the soft tissues as well. So how to diagnose lumbosacral radiculopathy? Through the lumbar MRI. How the patient will report to you? The patient will report the pain to you, which will be radiating from the lower back to the buttock and leg. So why buttock and leg, sir? Because some nerve compression is there. So some nerve might be after the compression might be causing all of these problems, that the pain, because nerves from the lumbar region will travel now to the leg portion or the lower trunk. So the patient will report the pain which will radiate from the buttocks or from the back to the buttocks or leg. Make sense? Yeah. So numbness and tingling in the leg, feet, toes. Yeah, because the nerve is compressed. The signals might be getting interrupted, the motor and sensory signals. Weakness in the muscle, reflex changes, reduced or absent reflex in the lower extremities. So the nerve got compressed, so the patient is not going to feel sensation in the lower trunk anymore. Let's hear it from the patient. The patient complains the pain in the lower back, weakness of the right foot, impaired walking. Examination says painful palpation on the lumbar area. Cough impulse sign is positive, like the when the patient is coughing. So he might be reporting some pain. So the lissage is positive. So when we try to elevate the leg of the patient reports the pain, because the problem with some lumbar portion. Positive at the angle of 70. The Achilles reflex is absent on the right. If we try to answer what is Achilles reflex, it is explained with the photo in my first video. So Achilles reflex is the doctor tried to strike the hammer below the patella bone of the patient on the leg. So the leg is supposed to react on it. Leg is supposed to elevate when we strike the leg with the neuro hammer. So the reflex is reduced because the nerve is compressed. Weakness in the extensor muscle of the right foot, problem in standing on the right heel. The patient is diagnosed with the lumbosacral radiculitis, right foot paresis. Group of medicines should be prescribed in this case. So I hope the diagnosis is clear in this case, guys. The diagnosis is lumbosacral radiculitis. Only one question in the crock: how you are going to manage this patient? So the patient needs the inflammation management plus the pain management. So the drug of choice, or let's say the group of choice, will be NSAIDs. if we provide the NSAIDs to the patient, this is pain management plus this is inflammation management. So I hope you understand about the lumbosacral radiculopathies. So this is it with this video. Let me know in the comments if you have some problem or if you are still marking some questions incorrect. I will discuss it in the comment box, and see you in the next video.